So what's going on? You guys saw last night me and Alex's workout. I did 30 minutes of the stair climber. Afterwards, me and him lifted, did chest and triceps last night. I've been really trying to stay on top of it this week. I actually have a clinic appointment tomorrow and a clinical trial appointment tomorrow. So tonight I'm on my lunch hour right now. So every day this week, it's like a no slip up week. It's like cramming for the finals in college because I have clinics. So I want like my PFTs to be the best they can, my weight to be up. I've been eating all I can. I've been working out every night, and I've been coming out my lunch hours, doing my breathing treatments. So as you guys can see over here, I have my inhalers, I have my airway clearance device, and really trying to get crap out and be all good to go for tomorrow. So I'm actually gonna be by myself. I'm staying at this it's called Friendship Inn, but it's this place through the hospital. It's really cool. It's for patients or patients' family members and things, and it's very clean. The lady that owns it, it's very nice. But yeah, I've stayed there, and it's just like a $30 whatever donation, and then you get your own room. They have 2 bathrooms, so you do have to share a bathroom. I think there's only like 4 bedrooms, so there's not really ever that many people there. And then it's a house, so you get a kitchen, you get a living room, things like that. It's always really clean. It's always good. But I'll get off work tonight. I'll drive the 4 hours down to Kansas City where my clinic is, and then I'll stay there. I'll probably get there like 10 o'clock or so, and then I'll do my treatments when I get there. But I'll do the quieter ones. So I won't bring like that big heavy vest. I won't bring my cornet that's pretty loud for airway clearance. I'll just bring the aerobic cutout you just saw, and then I'll bring like my nebulizer for my bronchodilators, albuterol and stuff. Yeah, I'll go to sleep tonight, and then I'll wake up tomorrow and eat a quick breakfast, do my treatments, and then head to the clinic. So I'll take you guys along for the ride. But yeah, this week I've been trying to come out every day on my lunch hour, get quick treatments in. I eat after I do my treatments, so it's like 30-minute lunch hour to do treatments, 30 minutes to eat, and then I'll have a protein shake in the middle of the day, like before I get off work, and then I go home, I eat again, then I usually go to the gym, and just really trying to stay on top of things, no slip-ups, and just hopefully we'll nail this appointment down really well. But we'll see what happens. I'm about to go back into work and eat, and I'll catch you guys a little bit later. So I didn't say it was I thought this trip was a day later, so I haven't packed yet. So I just got home. I'm gonna pack real quick and head out. So yeah, I get to packing. Look at this driveway. Look how narrow this driveway is. This is insane. My car's freaking out. Oh my gosh. Oh god. Oh my god. Alright guys, so I made it to KC. I am exhausted. It is 11:37, so just about midnight. I had clinic in the morning, so I'm actually going to wait for this to focus. I'm actually going to use my treatments right here in the car in the driveway because my cornet is very loud, as you guys probably already have heard. But I'll use my treatments real quick, and then I'm gonna sneak upstairs. It's very like creaky stairs, so it's really loud. They said it's full tonight. So there's 4 rooms. I have 1 room, and then the whole house is full. They said so. I'm gonna try to be quiet, but I'll show you guys inside as soon as I get up there and get my treatments done. All right, let me give you guys a tour of where I'm staying. guys, so I made it. It's kind of a creepy house, isn't it? But it's a really nice place to stay. The owner's really nice. And I'm getting ready for bed. I'm gonna go to sleep. I don't like taking like sleeping pills because when I do, the next day I feel coming down and dragging. But whenever I sleep somewhere new like this, especially when I have clinic the next day, I definitely want to take something to help me sleep, just to make sure I get the sleep I need and do good at my tests. So I have Ambien here, my water, salt to go in the water, a spit cup, and my essential oils are in there. So I'm gonna put a lot of essential oils on tonight. I got my cased in neb here. I'll do my albuterol with, and then here's my med bag, nebulizer or nebs. But brought my iPad, headphones, so I'll be watching some YouTube videos while I do my albuterol, and then I'm gonna go ahead and go to sleep. It's about midnight, 12:30 almost, and I'm gonna get some sleep and then find somewhere to eat for breakfast and go to clinic. So I'll see you guys in the morning. Just made it to clinic. Look at this parking, guys. Like, this is the spot I had to choose because it is so jam-packed. I had to squeeze in between these columns right here. Pretty nuts, if you ask me. Anyway, so I got a whole morning routine done. Hoping to have a good clinic today. Yeah, I'll film the rest. Like, we want to see more clinics and gym stuff.
So, obviously I know you exercise a lot.
Yeah.
This week in the gym, been able to get in, do okay, or more cardio or lifting, or what kind of?
I typically do like 30 minutes of a stair climber, and I'll go lift for an hour and a half.
Okay.
Monday I went, and I was a little out of breath, but I was fine.
Okay.
And then Tuesday and Wednesday I didn't go, just because I don't want to wear myself out for the clinic.
Okay, gotcha. Okay. Well, as long as that was going okay, at least on Monday, then that's always a good gauge of how things are going.
Yeah, I was a little down, but not bad.
Not bad. Okay. I'm gonna lift the back of your shirt up here. Okay. All right. Let's deep breath.
All right, clinic is over. It's a long day of appointments, and my camera battery died like right when I was starting PFTs. So some of that footage you guys saw is recorded on my phone. Anyway, but yeah, clinic was good for the most part. So I'm in a clinical trial, and I also have my CF clinic, which I can't share with you guys what the drug is that I'm in the trial for, because the company that's holding the trial, that's one of their stipulations in the contract. But it's a very exciting trial, I think. I read a lot about it, and I actually know other CFers that like have experimented kind of with. It's hard to say. It's hard to describe without like telling you guys what the drug is. Anyway, point being, I think it's going to help, especially, I mean, obviously if I'm not on the placebo. Anyway, I'm excited for the trial. So I had a little trial appointment today, and they kind of go over their stuff, and then I also have my CF clinic appointment. Weight is up, so that's very exciting. Now I've been trying really hard the past couple of weeks to get my weight up. I've been doing that by meal prepping planning out my meals, having a weight gain protein shake in the middle of my day while I'm at work, and then really tracking my food on my phone, and then also, of course, staying consistent with my working out. I've gained to like 6 or 7 pounds since my last visit. So my last visit was earlier this year, I want to say, like in early January. So it's been a little while, but anyway, really good weight gain. He even commented, he's like, you're looking a lot fuller, your chest is looking bigger, things like that. So that was exciting to hear, because it just shows like my hard work that I've been putting in the gym and trying to eat better is actually being noticed. So awesome news. PFTs were not that great. They were 41, which isn't bad at all, but my last PFT with them was 43, and of course I'm always trying to improve and get better and better. I've actually been doing a lot of cardio the past few weeks, and I've been doing like the stair climber 30 minutes before I start lifting, and I actually feel like that's really helping. But this week we've had a lot of people go home sick from work. One guy had the flu for 2.5 weeks. A girl that sits right next to me went home sick the other day, and she didn't come in yesterday. And then one guy that really never misses work went home sick a couple days ago. So needless to say, I've kind of felt crappy because of that. Luckily, I haven't had to stay home or anything, but I just kind of feel like I'm on the edge, if that makes sense. And on top of all that, as you guys know, we take Pulmozyme for CF every day, and I've been out of Pulmozyme for 5. This is the 6th day, and it's been a mess. So I ran out of Pulmozyme. My insurance wouldn't cover it until I signed some form. I signed the form, sent it back last week. Well, they couldn't find the form. So then the representative emailed me the form. I signed it, emailed it back to her. This was like earlier this week. And yet still, they're having problems finding it, getting it, whatever, registered, all that crap. And so they literally called me yesterday. It was like, oh, we're so sorry. We're going to get it straightened out. I'm going to call my higher ups real quick, and they're going to figure out. We'll call you right back. No call back. So, dealing with insurance and having a freaking lung disease, or any disease for that matter, or needing medication on a regular basis, and you have to call mail order pharmacies, sucks. Biggest hassle in the world, and it drives me nuts. Like, if they would just hire like the smartest people ever to deal with people's medications and insurance, it would be so much better. Anyway, vent over, right? Rant over. But yeah, guys, blood draw went well. PFTs are decent. Weight is up. I gotta keep sticking with what I'm doing. I actually have standing orders to do PFTs near my house. So anytime that I'm just feeling good one week, I've been doing a lot of cardio, I feel like I'm breathe better, I'm gonna go do PFTs and try to get them up, and they'll send them to my doctor. So that's exciting. Oh, one last thing I want to tell you guys. So we're gonna try to stop my Symbicort. So a lot of you guys probably take Symbicort, and Symbicort is a a inhaler that's a steroid, and it's supposed to reduce inflammation in your lungs. Been taking it for years, right? It's one of these medications that when you have CF, because it's a obstructive lung disease, whatever, but like when you have CF or asthma, COPD, things like that, it just automatically gets tossed into the rest of your medications, as like, oh, well, he should automatically be on this. So I've been on it for years. Don't remember when I even started. And I take 2 puffs morning and 2 puffs at night. So the doctor tells me today, we're actually going to try to wean me off and stop Symbicort altogether. He's trying this with me and the rest of his CF patients. And the reason being is it's something that looks good cosmetically on paper that you take it, but it's not necessarily helping CF. And actually, it's shown to have a higher risk when someone's taking it of getting pulmonary infections or exacerbations, and a higher risk at developing MAC bacteria. And so if you guys aren't familiar with MAC bacteria, it's a bacteria that's very hard to treat. And typically when you get MAC bacteria, you have to be on antibiotics. I think it's like 3 different antibiotics for like 9 or 10 months just to get over it. And it's not like an easy antibiotic course. They're pretty strong toxicity and everything. So Long story short, right? We are going to try to get me off of Symbicort, wean me off of it over time. I'm on 160 twice a day. So right now I'm gonna go down to 80, half the dosage, twice a day. And then I'll do that for 2 or 3 months. If I notice signs of getting worse, shortness of breath or anything like that, I'll let them know. And then after 2 or 3 months, I'll totally stop it and see how that does. Anyway, that was a clinic visit. Now I get a wonderful 4-hour drive home. It's gonna be a really good time. Not. So, anyway, the great part about being in studies though, is usually if you're in a drug study, they will pay for your food that day and pay for your traveling and things like that. So I'm gonna take advantage of that and really find some freaking delicious places to stop and eat because I'm starving after having all these appointments all day, getting blood drawn and blowing pretty hard my PFTs. Anyway, that's it for this video, guys. I'm gonna wrap it up here. Clinic's over. I might show you some fun footage when I get back and reunite with Ralphie. But for the most part, you guys saw clinic. Hopefully that was a fun little video footage. I'm gonna try to start filming more clinic, more of like my everyday life. Just throw a lot more fun things in there for you guys. If you guys haven't noticed, I'm gonna try to get some more friends involved in my videos as well. I mean, I know I probably look great. I'm probably funny as hell, but you guys gotta want some variety, right? Like you want to see some of my friends and like what I like to do every day. So I'm still gonna keep the CF stuff going on. I'm gonna try to film more gym footage and more everyday life fun stuff. So we'll see how the videos go, guys. All right, thanks for watching this video. I will see you guys in the next one. Bye.